Welcome back to Ladies of Another View. And I want to welcome back, I'm not welcome back, this is our first time having on David Ridenour. And he is the chairman of the National Center for Public Policy Research. And he focuses on able Americans. And he has a son that has suffered from mental illness. I don't know if that, or mental health issues. And the government often is not your friend in these situations. Welcome to the show, David.
Well, it's such a pleasure to be with you today. Thank you for the invitation.
Well, I think family is key here. We just talked about the stabbing on the subway in Charlottesville, and it's clearly a mentally ill man. But he had 14 brushes with law enforcement, and nobody was looking out for him. Nobody was looking out for us, and it ended in tragedy. You advocated for your son, and we're going to talk a little bit about that in the next segment, what your personal story is. But tell me how the government is something that you're fighting against and not really there for abled Americans.
Well, I think most of us, unless we have a direct experience with somebody who is having behavioral problems, think the government has this handled, and they really, really don't. And what I found, and what I think many people are finding, as well as that situation that you mentioned in New York, is that there is a shortage of beds for people who have mental health issues. As a matter of fact, we are short by hundreds of thousands. And it is really the government that is to blame for this, because back when the Medicare and Medicaid Act was passed in the 1960s, they added something called the Institutions of Mental Diseases Exclusion, which meant that no hospitals that had more than 16 beds could be reimbursed by Medicaid. So what's happened as a result of that? What's happened is it's contributed to, suffering of individuals. It has contributed to homelessness. It's contributed to massive incarceration. And it didn't produce any cost savings. As a matter of fact, once you lose economies of scale, the prices go up. So there are shortages. And as I said, in the hundreds of thousands in this country, people with undiagnosed mental disorders who should be getting treatment.
And I think you bring up a good point there because, we've heard for years our jails are just way too full. We need to build more jails. And to some of us that kind of watch these things, the mental illness of people that are incarcerated, I believe that rate is like 67% or something like that. They can be diagnosed with something that, and I'm not painting victimhood, don't get me wrong
Right.
here, but the fact that instead of them going into, say, a psychiatric bed in a hospital to either come off their drugs or to get some help to get a breather before they get placed in a place where they can stay for several months to get better, they just get thrown in jail. Well, then you've got all of them in jail with what kind of service? And what does that do to the people in the jail that are trying to take decent care of them? They're not equipped, as far as I have been told, for what they have sitting in those cells. And what is your experience with that whole?
Well, the prisons have limited capability. There's about 1.8 million people who are incarcerated right now. There's some estimates that say 270,000 of those have mental illnesses. I've seen figures that are much higher than that, more than 50%. And the homelessness situation as well, 67% of them do have some kind of undiagnosed mental illness, and oftentimes they end up in the prisons. So should we be treating the mentally ill as criminals, or should we be giving them the treatment that they need to get better and become productive members of society? I think that we can do much better. We have to do much better because a lot of people are suffering.
Well, and I think our last segment that kind of brings it to the forefront where, known mental illness, but then you're out on cashless bail or you're out, 14 offenses and you keep getting let out onto the street again. And even the mother said she had to kick him out of her house because he got violent. I think it was that story. He was diagnosed schizophrenic, but then there was nothing to follow up with that. And so it is a sad story on every side of the aisle. I don't care who you are.
Well, it's very difficult for family members when, their child become stronger than they are. And they want to keep them home, they want to keep them safe, but they can no longer do so because they fear for their own safety or perhaps the safety of other loved ones in their household. And that's how so many people end up on the streets. And from on the streets, they often end up involved in crime, drug abuse as well. So we have to get this addressed, and there are ways to address it. And one of the ways of addressing it is getting rid of that IMD exclusion, the Institutions of Mental Diseases exclusion, which limits the size of hospitals. That's what's creating the shortage here, by and large, and we need to address it.
Well, and that also pertains to Medicare as well, right? Medicaid and Medicare.
Well, the primary driver is Medicaid. Medicare is primarily for those who are elderly, but of course there is an issue there with Alzheimer's and how we treat people with Alzheimer's.
Yeah,
Absolutely.
a lot of times people have an idea, oh, we're going to go to the smaller institutions. I lived in Portland where they emptied out the mental hospitals and they were all on the street, and it was kind of scary sometimes. Like you had in your head something that was going to work, but it really didn't, and it made things worse. And I think that's what we're seeing. Like you don't have the economy of scale where you can serve more people better. Is it a perfect situation? No, we got real problems in our mental health and our prison system. David, I want to stop right here because I want to hear a little bit more about your story, and then you can include more about the policy and what we need to look at when we come back.